So, okay, like if we're talking about gums, what do healthy gums look like?
Good question.
Yeah.
So I will go back to brushing a little bit because, a child or someone might be in the bathroom for their 2 minutes and you can hear them going, but doesn't mean they're doing it correctly. Okay, so especially with children, it's important that children are assisted with their brushing till about 8. It sounds a bit crazy, but they don't have, number one, the concentration, obviously, and sometimes the dexterity to do all of the teeth well, and they're often always missing, one or two in the same place. They've also, often, like young children under 8, also have adult teeth coming through. And they can take a long time to come up and have the gum sort of only be poking through a little bit. And because it takes so long, even though there's a tiny bit showing in the mouth, it still needs to be brushed. And kids don't feel a tooth there, so they don't put the brush back there, So I think it's just a second set of eyes to make sure. So we do recommend that children are assisted with brushing till about 8. So often also it's a bit of a scrub, and then only on the sides. The tooth, like I said, bit of a cube, making sure you do the inside, the top, the cheek side, and every corner of your mouth. Okay, it is quite good to give your tongue a bit of a brush too, because it harbours, it holds a bit of bacteria. So, like I said, sometimes people are a wee bit of, they're a little bit all over the show with their brushing. So making sure that the bristles of the brush touch right up at the gum line. By all means, you should not be a scrubber, but thorough. So making sure that they touch the gum line, because lots of people have really nice clean teeth, but then you lift the lip a little bit and they're missed at the gums. Okay, because they're only doing this, they're standing on the mirror going like that instead of lifting and getting right up at the gum line. So when you have plaque, which is the soft stuff, the soft furry type stuff that sort of develops on your teeth, so when you're messing with areas with the toothbrush, it sits often at the gum line and it makes the gums red and inflamed and a bit angry, and often it will make it'll look like your gums are bleeding when you're brushing them. So if you've missed the same spot for a few days and then you brush it, it'll probably bleed. But it's nothing to worry about. It's just because your gums are inflamed and a bit angry and red because they've had that plaque irritating them, if that makes sense. So ideally, back to your question, healthy gums would look like quite a soft pink, not red, not dark. You usually, ideally, that have nice sort of little triangles of gums in between the teeth. When things have been inflamed and angry for a long time, the gums get quite very red and very puffy, and then the little triangles actually flatten out a little bit. And and that's early gum disease. So it's opening another can of worms of gum disease. But so if you see any areas that's a little bit red, continue to brush it really thoroughly, but not too aggressively, because if you're brushing too hard, it will actually be worse for the gums. So I know particularly Pacifica people often want to use hard brushes.
I was just about to ask.
Yes. They're always like, no.
We need to use.
I do actually understand, because it makes it feel more clean, because it's, but the bristles are too coarse for the gums if you're brushing that area carefully. So use a soft toothbrush, and just make sure you're getting, because if you are a scrubber with a coarse brush, it will actually aggravate the gums and it makes them pull up the teeth a wee bit, and you can get quite sensitive, because if the gum has pulled up where it shouldn't have, it's exposing little nerve endings, and that's why things can be quite sensitive to colds and sweets.